Hi Michelle, my name is Dr. Agarwala at Panorama Orthopedics. It's nice to be able to see you today with a virtual visit. Can you tell me about the symptoms that have brought you in to see us today? Panorama started doing virtual visits or telehealth about a year ago. So in 2019, a couple of our providers started trialing it, especially for patients that were coming from a longer distance. It was a really valuable tool to interface and video and discuss with patients their care, especially when they were coming from multiple hour drives away. Then in this past few months, we've ramped up to all the providers at Panorama providing virtual visits for patients, and this is allowing patients to stay in the comfort and safety of their home and be able to interface with their physician and have their care visit provided it that way.
I was stayed at home to be able to do the visit. My wife was able to participate from home, which was awesome. And we had what I would call the personal one-on-one with the doctor. He was very interested in my situation at the time, where I was with my recovery. I did have a couple of concerns that he immediately addressed. He was able to look at my incision sites. He was able to look at how far I was able to have my arm. So it was just like being there. It was just more efficient use of my time, and quite frankly, probably more efficient use of his time.
Some of the other advantages have been avoiding wait times. Patient visits are starting right on time, interestingly enough. My 8:15 visits are starting efficiently. They already have their imaging done ahead of time, so we're not wasting time with the patients in the waiting room, going over to x-rays, changing into a gown. All of that's been accomplished so that when we're starting the visit, working through the visit and discussing healthcare with our patients, we've really avoided some of the extra time that patients have been spending in physician offices that are unnecessary.
You get an email to invite you to the virtual visit, and they give you a specific time. In my particular case, the visit was 10:30. And 10:30, the doctor appeared. He was right there. If anybody's concerned about the technology, I wouldn't be. They guide you right through the process.
Can you show me where your neck is hurting? I've been able to, for myself as a spine surgeon, have patients show me the location of their pain, show me the strength in their legs. I've been able to do a neuro exam and identify lack of sensation or motor strength in their legs, and I've been able to arise to the diagnosis and order appropriate imaging and then evaluate that imaging despite some of the limitations of my ability to examine patients on a virtual visit.
It's all the conveniences of an office visit without any of the hassles.